If you're not one of the 20 million Americans suffering right now with seasonal allergies, well, count yourself pretty darn lucky. Allergist Dr. Alice Hoyt is here from Vanderbilt. What a pleasure to have you here.
Thank you so much for having me today.
Now, I know that so many people are sneezing, sniffling, coughing, runny nose, eyes itching, you name it. But it's not just this time of year, sometimes it's year round.
Right.
So for this time of year, what are the triggers, Dr. Hoyt?
So trees and grasses, as you can probably tell by looking at your car, all of the pollen, not just your car, lots of cars on the road, they're just covered with pollen because it's finally becoming springtime and trees are starting to bloom and spread their pollen so that they can procreate, and grasses are starting too. And those are the things right now in the springtime that folks become allergic to and are allergic to.
But then there are allergies, obviously, that people suffer from year-round.
Yes.
And I guess a lot of people really wonder, am I sick? Is this something more than, a simple allergy?
Right.
How do you know when it's something more serious?
So if someone's having fever, chills, throwing up, those symptoms are not consistent with allergy. When we think of allergy, we think of itchy, drippy, sneezy, you feel full and congested, coughing, drainage, those types of symptoms that make you feel miserable, but not necessarily having the fevers and the chills. Those would be signs of infection. And you're exactly right. We can have those symptoms year round because some patients have perennial allergies, meaning more year round, and they can be allergic to cats. And so they might not have a cat, but maybe their coworker has a cat. And cat dander gets on the clothes, and then the coworker says hello and breathes in that cat dander, and the sniffles begin.
That's simple.
It
can
is
be that vulnerable.
It can, absolutely.
Okay, so you've gone over some of the symptoms. As far as treatments, I think most people are getting over-the-counter medications. I was thinking about this before the interview. Is there the possibility that over time, when you're using these over-the-counter meds all the time, that you develop an immunity to them and they quit working?
That's a good question. We hear that a lot. Generally, no. Generally, what will happen is that your symptoms will get better, and then you're like, oh, my symptoms are better. And then you stop the medicine, and then they come back. But generally, developing an immunity doesn't so much happen. It's really patient dependent, though. So if you were to come to me and say, you know, Claritin really works, but then it kind of stops working, then I would say, okay, let's do an antihistamine carousel, meaning you use Claritin for 1 month, then you switch to Allegra, then you switch to Zyrtec, and you sort of rotate. So we really try to tailor our recommendations to the patient.
All right, very individualized.
Absolutely.
Can you develop allergies at any age? I've heard that you can, and so many people complain. They say they moved to Middle Tennessee, and all of a sudden, they get allergies. They've never had them before.
Must have been in my clinic this morning.
I was there. No, I wasn't. But yeah, that's a familiar story.
Yes, absolutely. That's a familiar story, especially with so many people moving to this exciting city. Usually, you know, maybe they've been here a year or so and they're like, man, it's springtime and I just can't take it anymore. So yes, really at any age you can develop these seasonal allergies.
Okay, so how do you know then when it is time to see a specialist? You treat it, but then it progresses, and the fever, is the fever one of the key things then?
Fever is not allergy.
Okay, that's not allergy.
So there is what's called hay fever. Hay fever was first described, which is the same thing as allergic rhinitis, but that was first described really in the 1800s when all of this started happening. Looking back at biblical days, there wasn't allergy. Allergy is a very new disease, and so
I didn't realize that.
Yeah. I know, right? It's a very new disease, just like food allergy, just like asthma. They're new diseases, and we think they have something to do with our improvement in hygiene. Hygiene, very, very good, but we think that something about hygiene is sort of changing the immune system or changing the way our bodies respond to the environment. That is under significant investigation right now because allergy is a multi-billion-dollar business.
I'm sure it is.
And so that's why really if somebody's thought about seeing an allergist, I really encourage them to call, make the appointment, because what we can do is we can identify what they're allergic to with either skin prick testing or blood testing, so that then we can give them a very personalized, tailored plan for when to take what medication, because the allergy aisle is confusing.
It really is.
Everything says allergy cold, allergy sinus, sinus congestion, and reading the names of the individual actual medications, that can be very, very challenging, even for physicians. So if you don't have a really good plan from a specialist, it's easy to sort of waste money at the pharmacy.
Great points. Are there ways you can decrease your exposure?
You can decrease exposure, but a lot of those ways mean staying inside and closing windows, and we don't want to do that. No. And that's why you can see an allergist, so that we can work together as a team, take control of your allergies, treat the symptoms so that it doesn't affect your life.
Allergic sinuses, I probably shouldn't be jumping off into that area, but that is part of this as well, isn't it? Sort of a subset?
Yes.
More severe problem? Or
in a way, yes. Yes. So patients who have sinusitis, itis meaning inflammation, sinus meaning these sort of air pockets in our faces, they can fill with goop and inflammation, and sometimes that is associated with allergies, meaning your body sees tree pollen as a foreign invader and it's trying to attack it. And when you get continual inflammation in your sinuses, that can certainly set you up for infection. And so we will actually ask patients, how is your sense of smell? Because if your sense of smell is decreased, then we're thinking that those allergy cells that come along with inflamed sinuses are actually secreting a little nerve toxin and making your sense of smell go down. So that's a common question that an allergist will ask you to help determine if your sinuses are involved.
Sense of smell. All right, interesting. So where can we find out more information? Is there a resource for folks?
Yes, so always come to Vanderbilt Allergy, Google that, you'll find our website, but also look at our big academy. So the American Academy of Allergy, Asthma, and Immunology, and the American College of Allergy, Asthma, and Immunology. But I can't more strongly recommend talking with your doctor, coming to see an allergist, so we can get you a really personalized plan.
Okay, very eye-opening. Didn't realize this was really a new kind of illness and disease.
Yeah.
Thank you so
Sure,
much.
thanks for having me.
Happy spring and summer.
Thank you. You too.
Okay, and we'll be back with more right after this. Thank you.